Good afternoon everyone, I'm Dr. Vasavi. My topic for presentation is there a correlation between the dry eye symptoms and the mammography findings by autorefractometer in individuals with diabetes? Financial disclosure, no conflict of interest. Dry eye is a common disorder which causes ocular discomfort and vision issues due to abnormal tear production, evaporation or tear composition. Meibomian glands in the eyelids form the lipid component of the tear film, which helps in preventing the tear evaporation and maintaining the tear film stability. When these glands malfunction, it is called as meibomian gland dysfunction, and it often leads to dry eye. Autorefractometers, which are commonly used for checking the refractive errors, have infrared technology for visualizing the meibomian gland. This simplifies the study of gland abnormalities and their connection to the dry eye symptoms in people with diabetes due to their widespread availability. Aim of my study is to investigate the potential correlation between the dry eye symptoms and the mammography findings assessed by an autorefractometer in people with diabetes. This is a cross-sectional study. 50 patients of diabetes mellitus with dry eye symptoms who fulfill the inclusion and exclusion criteria attending the OPD services of Government Regional Eye Hospital, Visakhapatnam were included. Inclusion criteria is age more than 18 years and symptoms of dry eye. Exclusion criteria is recent ocular surgeries, ocular systemic conditions affecting the ocular surface like connective tissue disorders, recent contact lens usage, use of medications affecting the tear production or ocular health, pregnancy or breastfeeding. Study period is 3 months from June 2023 to August 2023. Data is collected from the subject who met the inclusion and exclusion criteria. Total 100 eyes of 50 patients is included in the study. The comprehensive evaluation of the study participants included the following key assessment: demographic data and clinical history, slit lamp examination for assessing the ocular symptoms, lid issues, vascular changes and meibomian gland dysfunction, focusing mainly on the MGD. Tear film assessment, we have done tear film height and T-bud for stability, and dry eye assessment is measured using ocular surface disease index questionnaire. Mammography is done using an autorefractometer, and we have used 4 grading system as proposed by Arita et al. Grade 0 is no gland loss, grade 1 is less than 1/3 of the gland dropout, grade 2 is 1/3 to 2/3 of the gland dropout, grade 3 is more than 2/3 of the gland dropout, and grade 4 is complete gland absence. This is the mammography findings. We can see right side picture I have marked. There is one gland loss and gland tortuosity is seen. This is a patient with mild dry eye. Meibum expressivity score, we have assessed each 8 glands in the central third of the lower lid. 0 to 3 grade on a 0 to 3 scale is given for each gland. 0 for clear meibum, 1 for cloudy meibum, 2 for cloudy meibum with the debris, and 3 for thick like toothpaste meibum. Statistical analysis was done using SPSS program and unpaired student t-test for comparing the means of the qualitative data, and Pearson correlation R is used as a correlation coefficient. P-value of less than 0.05 is considered to be statistically significant. Observation and results. In this study, total 100 eyes of 50 patients is analyzed. Here in the study, 20 males and 30 females are included, and mean age group is 52.02 years. This is the table. This is the graph showing type 1 and type 2 diabetes subgroup. In our study, 20% are type 1 diabetes and 80% are type 2 diabetes. This is the age distribution graph. Most of the people in our study are aged between 44 to 54 years. This is the graph showing OSDI versus age. As there is increasing age, the OSDI scores are proportionally increasing. This is the graph showing meibum expressivity score. Most of the people in our study are having a meibum expressivity score of 0.6, between 0.6 to 1.3 in a mean range. That is mild, that is clear meibum. Meibum score versus OSDI scoring. OSDI scores in type 1 and type 2 diabetes. Most of the people who are having type 1 diabetes are showing less OSDI scoring. And the results, there is a positive correlation between the OSDI score and the MEIBO score, and also positive correlation is seen between the meibum expressivity and the MEIBO scoring. The study aimed to find the link between the dry eye symptoms and the mammography findings. Dry eye symptoms are linked to the meibomian gland dropout, and dry eye symptoms and the OSDI scores are more in type 2 diabetes than type 1 diabetes. There is no significant sex disparity in the scores in our study. Longer duration of the diabetes having a higher test scores. Our studies results are similar to the Semra et al. Who done the mammography findings in type 1 diabetes in children with respect to MEIBO scoring. Limitations of our study is it's a cross-sectional study, so it limits the causation, and sample size is smaller, so it hampers the subtle correlations. So future directions explore the correlation between the longer duration of the diabetes and the MGD in the dry eye, evaluation and benefits of the improved glycemic control on the eye. Conclusion, it is essential to emphasize the use of autorefractometer for assessment of the meibomian glands in individuals for the ease of use and accessibility in the clinical settings. These are my references.